it is important, of course, to realize that declining fertility rates is not exactly the same as infertility, because infertility is mostly involuntary, and there is an aspect of declining fertility rates that comes because people are choosing to have fewer children. Current data shows that fertility rates are declining around the world. In 1950, the average number of children that a woman would have had was 5.1. Currently, it's about 2.3, and is predicted to decline to 2.1 by 2050. So a fundamental question that people want to know is whether infertility is on the rise globally. And out of this point, we don't have data that shows that it's on the rise. WHO and Human Reproduction Program looked at data published between 1990 and 2021 from all around the world, and we just don't have sufficient data points that are consistent enough for us to make a conclusion that infertility is on the rise or indeed on the decline. What we do know is that we need more data from many countries that are comparable to assist us to determine what the trend is. At this point, even though we don't know what the trend is, one of the important achievements of the recently released estimates is that it provides a foundational statistic with which we can compare future estimates, and that will be extremely useful to helping us understand what the trends look like. Regardless of the trends, a point that we would like to make across is that we need to address infertility, because many people are struggling with not having adequate information on how to prevent infertility. When they have infertility, they don't have access to services. They don't know where to access services. And actually, even if they know where to go for services, they are incurring huge expenditures on treatment. And as a global community, we need to work better and ensure that people have equitable access to treatment, diagnosis, and prevention of infertility. And we know the people who are less likely to have support that they need when they are facing infertility. And those are people who are poor, who are uneducated, who are living in geographically isolated places, who are facing stigma and discrimination already, and who are unmarried. And these are all reasons for us to make sure that no one is left behind as we address infertility across the globe. It is important for us, as we are responding to declining fertility rates around the world, to ensure that policies and support that is available to people is provided to them so that they can achieve their preferred fertility goals and aspirations. We should not limit access to contraception in places with low fertility rates, total fertility rates, or limit access to or coerce people to have access to fertility treatments in places with low total fertility rates.